In this video, I'll walk you through the overview of the lymphatic system and then introduce you to the basics of the immune system. The functions of the lymphatic system can be divided into these three basic things: fluid balance, dietary fat absorption, and immunological defense. The first one, fluid balance, really talks about the fact that excess interstitial fluid has to be recaptured by the lymphatic system and returned ultimately to the bloodstream, which is where this all started. This fluid's called lymph. And we can understand this idea by looking at this diagram right here. Remember that our capillaries, our circulatory capillaries, are leaky, and they're designed to be so. Every time your heart pumps, blood pressure forces a little bit of plasma out into the extracellular space or interstitial space. Then fluid is collected by the lymphatic capillaries, shown here in green. So we actually have two parallel systems bringing fluid back towards the heart. The venous return, which carries blood into the heart directly, and these so-called lymphatic vessels carry this lymph up to the subclavian veins, where the lymph becomes blood plasma once again, right before it flows back into the heart. What would happen if this lymph were not recollected? Well, we would see swelling. In breast cancer patients, for example, those who have had lymph vessels damaged from surgery or radiation, oftentimes they have very swollen arms because the heart is pushing blood through their arteries, not shown in this picture. Some of that fluid is lost and it begins to congest this tissue. If we have normal, patent, or open lymphatic vessels, then the fluid can drain from those tissues back into the bloodstream. Notice along the way this lymph passes through lymph nodes. These are like little security checkpoints filled with lymphocytes and other white blood cells. The lymph nodes help to filter debris, germs, and potentially cancer cells from the lymph before it enters the bloodstream once again. Notice the location of these lymph nodes. They're not evenly distributed throughout the body, but rather they're collected in key regions for efficient checkpoints and for guards at the gates. These are the two ideas. Efficient checkpoints. So look at this. Although the leg doesn't have any openings where germs could get in, there is the chance that the skin could be compromised, or there could be some sort of internal infection that came in a different way. In that way, we can filter all of the lymph returning from the legs through just 8 or maybe 10 lymph nodes here in this so-called inguinal region. It's also possible through the urethra, vagina, or anus for germs to find their way into the body, and so too we have these checkpoints, lymph nodes, collecting germs before they hit the bloodstream. Because as severe as a urinary tract or sexually transmitted disease can be, it isn't as bad as septicemia, right? A circulating bloodborne infection. The lymph nodes help to prevent a local infection from becoming a septicemia. Here's another example of efficient checkpoints and guards at the gates. You might not think of it, but your GI tract is actually an external surface of the body. And when you eat things, they pass through your body, but they don't actually enter the body until they are absorbed through the gut lining. And so here, the lymphatic vessels are another barrier or checkpoint. Dietary fats, having been absorbed from the small intestine, are filtered through these lymph nodes on their way back to the circulatory system. Other examples of these guards at the gates include tonsils. These are actually modified lymph nodes in the nasopharynx, in the oral cavity, which help to provide some protection against bacteria finding a way into the body. And they do sort of form a ring around the oral cavity and the pharynx, which are two of our largest portals of entry for germs to find their way into the body. Moving back just a little bit, we see that there are two prime largest lymphatic vessels which drain the lymph into the subclavian veins: the right lymphatic duct on the right side of the body and the thoracic duct on the left side of the body. Look here at the distribution, the watershed of those ducts, if you will. All of the lymph coming from the right arm, right breast, and the right side of the face and head drain through this right lymphatic duct. Everywhere else, including the entire left side of the body and everything below the diaphragm, ultimately drains into this thoracic duct, which empties into the left subclavian vein. It's important to know, based on where we might find distributions of swelling. If the right lymphatic duct were damaged, we would see a very characteristic pattern of edema. Fluid that flows through these lymphatic vessels, as we mentioned, is called lymph. And it's very much like blood plasma, with the exception that it does flow through lymphatic vessels and there are no blood cells there. Here we see another illustration showing us where the thoracic duct empties and where the right lymphatic duct empties. And this tiny picture shows us the distribution of collection of lymph of those two different lymphatic ducts. Lymph nodes and lymphatic tissues are made of a bunch of different white blood cells. Macrophages and dendritic cells are quite similar. These are frontline immunological defenders who are just trying to filter out germs. They're not very specific. They can't tell the difference between one germ and another. They can tell the difference between healthy cells and unhealthy ones, or between your cells and foreign invaders. Lymphocytes are another class of leukocytes, another type of white blood cell, and these ones we're going to see differentiate into a bunch of different types of cells in our adaptive immunity video in a little bit. T cells, B cells, natural killer cells, plasma cells, and the like. So we find a lot of those packed into these lymph nodes. We can see lymph nodes have a lot of epithelial tissue and then a lot of white blood cells packed into this diffuse matrix. Lymph nodes are very efficient checkpoints because not only of where they're located, but the fact that there are always more vessels bringing lymph into the lymph node than there are draining it. So we see here 4 channels, maybe 5 or 8 channels coming in and only 1 channel going out. And so when you start to stack up these lymph nodes in sequential chains, you can really filter a very large volume of lymph with just a few lymph nodes. Notice that the lymphatic vessels also have valves, very much like veins. Excuse me. And not surprisingly, that's because this lymph is flowing at very low pressure. So we need to have these valves to prevent backflow. The spleen is a strange organ that belongs to the lymphatic system. It is sort of hugging the outer curvature of the stomach. We can see it's very vascular, and within its internal cavernous structure, we see both red pulp and white pulp. The white pulp can be thought of as dense collections of white blood cells. And so the spleen itself can work like a very large lymph node. It also allows these white blood cells to enter the bloodstream during periods of severe infection. So you could sort of think of the white pulp as being sort of a battalion of white blood cells in reserve. And then if you have a severe and sudden infection, you don't have to wait for new blood cells to be formed. The spleen can add troops to the battle right away. The red pulp can be thought of as a pint in reserve, a pint of red blood cells, that is. It doesn't actually hold a pint's worth of blood, but a pint's worth of red blood cells. And so in the event of a hemorrhage or a severe drop in red blood cell count, the spleen can try to save you by adding new blood cells to the bloodstream. And we can see it comes through these venous sinuses. The thymus is another strange organ located right on the anterior of the heart, or maybe right where the arch of the aorta is. The thymus is an immunological gland. It has properties of a lymph node and a few properties of an endocrine gland. And here's the most important thing you need to know. It's the site of maturation of T cells. Some T cells are produced here, but most of the T cell maturation, the training, getting these lymphocytes ready to go, T cells are lymphocytes, and the T comes from the thymus. Here's a nice overview of the lymphatic system and the things that we've learned so far. Fluid reabsorption, right? Arterial fluid that's lost is collected through the lymphatic capillaries and then filtered through the nodes, eventually re-entering circulation either in the thoracic duct or the right lymphatic duct. Dietary fat absorption, which takes place in the small intestine, by the way, absorbs fat. So my cheeseburger fat and bacon fat and olive oil and almond fat and chocolate malt fat eventually goes in through the gut into the lymphatic system and then into the bloodstream. Carbohydrates and proteins go directly into the bloodstream, by the way, but fats go through the lymphatic system. The spleen, allowing for some filtration of the blood. Bone marrow producing these lymphocytes, which enter the bloodstream and are then trained up or matured in the thymus so that they're ready to go. T cells, activated T cells. And then lymph tissues, including lymph nodes, are where these T cells are going to actually find the germs or cancer cells and then go to battle. So that's a nice overview of the lymphatic system. In our next video, we'll learn about immunity.